You get this EMR role, and as a physician, you're managing your own practice and managing your patients and those kind of things. And then you step into this role where you're really corralling hundreds of people, if not thousands of people, trying to get them to make a pretty significant transition. What did you learn about the people aspect of it and really motivating people and making that move?
So I want to comment first about the patient aspect. So people sometimes say to me, oh, do you miss taking care of patients? And I still do, but a very small amount. But when you're working in informatics, you're affecting whole populations of patients. So in some ways, it's much more impactful than seeing one patient at a time. So if you build an EMR to make the right thing to do, the easy thing to do, and improve care, you're much more impactful than that one kid who I saw. So that's just the patient comment. And I'm sorry, your question is, how do you get people? I think a lot of it is, it's two things. It's one, you become evangelical and you get people to understand the value. And also informatics, everyone thinks, oh, just put a hard stop, put an alert, do an in-basket message. And all those inherent things, in fact, one of the things we'll talk about later today is what everyone thinks will solve it doesn't. And so I think it's also getting people to say, well, what are you really trying to achieve? And let us work on how the software can do that. And so it's one of the most things I say most commonly in meetings is, what are we trying to achieve here? And so it's not just in the software, it's just in general, and like pulling everyone back and saying, okay, so if that's what we're trying to achieve, let's agree to that and then figure out the best path forward. So I think a lot of it is corralling, educating, and then a lot of it is also listening to people. And a lot of it is storytelling. Hey, I understand your concerns. Like Open Notes is an international, it's gotten a lot of press lately, and a lot of people have concerns. But start telling the story of the places that have done it successfully, and of the patient's value, and of the data, and it's much less threatening when you start telling a story.
Yep.
And listen and resonating with quality and value of healthcare and what it means to the patients and what it means to your practice.